All right, so we'll begin. Hello and welcome everybody to the Therapist Atlas. My name is Ananta Leslie Bailey, and I'm a registered psychotherapist qualifying in Ontario and an RMHCI in Florida, as well as a Canadian certified counselor. Today's episode, we are going right into it with learning about the Ontario process for licensure. And we have a special guest. Her name is Dela. Welcome, Dela. Please tell me a little bit more about yourself.
Absolutely. Thank you so much. So my name is Dela Lubin. I'm a registered psychotherapist in Ontario. And I got registered back in 2022. So I've been doing this for about the last 3 years, and I've really enjoyed it so far.
Okay, beautiful. Thank you so much. And we're going to just go right into it. So, the first question, can you tell me how your journey was to get registered as a psychotherapist in Ontario? What was that process like?
So the process was different then than it is now. Just recently, this year in February, the application process has been changed.
Yes.
So when I did it in 2022, I had to do something called the mapping tool.
Okay.
That was so the mapping tool is based on it's a set of 21 questions that you had to answer, and that was based on the entry to practice competencies.
Mhm.
It was a very, very fun process. If you did it well, you would end up with about 40 pages of write-in.
Mhm.
Um, so that was the application process I went through. The great thing for me was that the master's program I did, our professors were or are very familiar with the application process. And so even in classes, what they would do, they would give us like mock assignments, like my capstone course, we actually had to do like take a mapping tool and
Mhm.
answer where we've actually learned each competency.
Okay.
So that was in the capstone course. Apart from that, pretty much all of the courses in the course outlines, the course
Mhm.
syllabi, they would actually tell you what competencies, what CRPO competencies the course actually fulfilled.
Okay.
So so that was my saving grace, this program I did and the professors and their knowledge. So by the time I came around to actually doing my application, I actually knew what to do.
Okay.
Yeah.
So
So
that's beautiful. Because I know for myself, I did my program in the States. It's a completely different standard that we follow. So coming from the US, you have to do your own competency. Now tell me about the program you went to. Maybe some people have questions because they might be, interested in pursuing this and thinking, well, if your school is supporting on that process, then that might be something that they want to look into.
so yeah, so it's actually so I'll tell you how I got into it. So I actually did my bachelor's in anthropology.
Okay.
So it's not in psychology, it's nothing related to psychology. I did it in anthropology.
Yeah.
And then I was going to some years later, I was trying to decide what master's to do. And I'm walking down the street, I'm praying to God. I'm like, Lord, what master should I do? And I
Mm,
swear, God speaks to me. God spoke and he said, do psychology.
yeah.
And I'm thinking to myself, I can't. I've got a bachelor's in anthropology. But, anyways, I go searching and I found out that yes, you can do a master's in psychology if you have a bachelor's in some other degree. You
Yeah.
can do a master's in counseling psychology. So then I went searching for programs in counseling psychology. And actually, what I found that I fell in love with was the master's in pastoral studies in psychotherapy.
Mhm. Okay.
So the program I did is so at the time it was called a master's in pastoral studies and it
Mhm.
focused in psychotherapy. It's actually a recognized program by CRPO.
Beautiful.
But I didn't complete certain parts of the of that program, so I didn't graduate with the recognized degree.
Mhm, mhm.
So technically, what I did was unrecognized by CRPO, and
Okay,
that's
so
why
that's
I
the
had to apply the long way. Yeah,
the mapping tool.
yeah.
Okay,
So
okay.
this particular, so you can actually find it on CRPO's website. They've got listed their recognized programs. The one I did is it's at the Toronto School of Theology. So
Mhm,
it's a
mhm.
seminary program
Okay,
at University of Toronto.
okay.
And there are two colleges. So the Toronto School of Theology, I believe it has 7 different colleges, little colleges at U of T that
Mhm.
belong to the seminary. And 2 of the colleges offer this program.
Okay, awesome.
Yeah. So the college I attended is Emmanuel College, and the other college that offers the program is called Knox College.
Okay.
Yeah. So that's the program.
Mhm.
What else can I tell you about it? Yeah, I'm trying to think. Yeah, so that's the program.
Okay, awesome. So, you mentioned a little bit about recognized and non-recognized programs. Can you talk a little bit more about what it means? Because maybe somebody might not be familiar with the terminology.
Yeah, so a recognized program, not to be mistaken, do not call it an approved program. So it's
Mhm.
not approved by CRPO, but what it is, it's a program where the school has gone through the process of ensuring that they meet all of CRPO's competencies. And they've completed the paperwork, and CRPO has said, yes, you meet all of our competencies. So CRPO will have it listed on their website as recognized programs.
Okay.
So there are some in Ontario, and there are some that are not in Ontario. I think there is one that's actually, it's like City University, which is an American university, but they've got a branch in Canada.
Yeah.
So they could be in different provinces.
Okay.
Yeah.
Beautiful. Awesome. Okay, so I would like to know a little bit more about the different stages of licensure with CRPO. So that's the College of Registered Psychotherapists in Ontario. For people that are not familiar with that, yeah, what's the stages? So when you're coming out of school, what license are you going to be pursuing?
This is a great question. So the better way to think of it is not stages of licensure, but
Hmm.
categories of registration.
Beautiful.
And in fact, you can actually apply to CRPO when you're still in school.
Okay.
So when you're in your last semester, if you say to yourself, okay, I got 1 semester to go, you can
Hmm.
apply to CRPO.
Okay.
Or if you've completed 90% of your program, you can apply to CRPO.
Okay.
Or if you've completed everything with the exception of a thesis, you can apply to CRPO. So if you're still in school and you meet one of these, you can go ahead and apply to CRPO.
Okay.
Some universities encourage their students to apply at that stage because now they will be registered with the college and then they can go ahead and do their practicum,
Hmm.
but you don't have to. When I was a student, I did not apply. I just did my practicum, and after I graduated, I applied.
Hmm.
However, you have that option.
Yeah.
Yeah. So once you apply to CRPO, the first category you will be placed into is Registered Psychotherapist Qualifying. Everybody will be an RPQ or RP qualifying.
Yeah.
I should clarify, we sometimes say RPQ, that you're not supposed to. It's Registered Psychotherapist Qualifying. So
Yeah.
everybody, it doesn't matter if you've worked, in a different province as a psychologist for 10 years and you apply to CRPO. It doesn't matter your history or background. Everybody will be, the first category is RP qualifying.
Yeah.
So that's the first category. And then what that category requires of you is that you practice under supervision. So as an RPQ, you're currently an RPQ, are you?
Yes.
Okay,
Yes.
so you must practice under supervision.
Yeah, I'm like right there. I'm waiting for them to approve my hours, but I have everything. It's just they're taking so long.
Right now, they're very busy.
Yeah.
Um, as an RPQ under supervision, it doesn't mean, and I've met people who were confused about this, it doesn't mean you have to work for someone and they must be your supervisor.
Mhm.
It simply means that you need to have a supervisor. It could be you're working for a company, a clinic, and they have supervision for you. Or it could be you start your own private practice and you go and you find someone to supervise you. You meet with them once a month, twice a month, whatever.
Yeah. Yeah. Thank you for clarifying that because I think some people get that confused. So, yeah, it's nice that you're able to find a practice that you can work with. And then if you want to get supervision from someone that you have interest in that is tailored to, an approach or theory that you're more, aligned with, you can always find someone to do that for you. So I'm glad you clarified that.
Absolutely. The other thing about the RP qualifying category is that apart from supervision, another thing is that you can actually do the same thing that an RP independent can do work-wise. You can work with any clientele. You can start your own private practice. You have the same you can do the same work as an RP independent can.
Mm-hmm.
The only stipulation is that you do it under supervision.
Yeah. Okay.
Yeah. So in fact, when I graduated, I applied, I got approved, and I just started private practice right away.
Mm-hmm. Mm-hmm. Okay. So I want to know about the hours requirement. So how many hours of supervision do you need to be able to transfer into the next category?
So as an RP qualifying, the first set of hours you need to get 450 direct client contact hours
Okay.
and 100 clinical supervision hours.
Okay.
For the clinical supervision hours, half of it can be dyadic or individual, and half of it can be group. Now, these hours can come from, so it could come from your internship, your practicum, any hours you've collected since you have been a student in a program where you were trained to offer psychotherapy.
Okay.
So, could be psychotherapy hours, could be counseling hours, could be coaching hours. All of
Okay.
these hours count. Anything that's counseling, coaching, psychotherapy.
Yeah. Okay. And now when you have those 450 hours and the 100 hours of supervision, what is the next step that you need to do to complete to transfer as well?
You're an RP qualifying, you've
Mhm.
got supervision, and you're collecting your hours. The other 450 DCC hours and 100 CS hours. The
Mm,
other component, the other thing you need to pass the registration exam.
okay.
So that's the other portion. The
Yeah.
registration exam, yeah, go ahead.
Yeah, I was going to ask you, tell me a little bit more about that exam.
So it's a very fun exam. It's not as hard as people think. I actually offer a course on it, an exam simulation course.
Yeah.
And so the exam, um, it consists of 10 cases, 10 unique client cases. And it takes about each case will have about anywhere from 5 to 8 segments. And it sort of looks like a multiple choice, but it's not just choose one answer. It's choose as many as would be correct.
Hmm.
And you've got 3 hours to do it. I'm convinced it only takes about 2 hours. I think they just give you an extra hour. It took me about 2 hours and I wasn't rushing. So it takes about 2 hours to do. Um, the college will give you 3 chances to do the exam within 2 years.
Hmm.
So within 2 years, they will at some point, so you don't get to decide how can I say this? They will tell you when you are eligible to do it.
Okay.
You will get an email one day saying, congratulations, you're eligible to write the exam.
Hmm.
And that first email, you can say, yes, I'll do it, or you can say, no, I'm going to pass. Then if you decide to do it, you go ahead and you do it. If you decide to pass, you'll get a second chance, and then you'll get a third chance.
Okay.
Um, in order to transfer into the second category, you need to pass the exam, and then you need to have your 450 DCC hours and your 100 clinical supervision hours.
Okay.
And as long as you've got these things, you can transfer into RP, Registered Psychotherapist.
Okay. Beautiful. Now, I remember seeing there's a third category.
Okay, good point. Okay.
Tell me a little bit more about that because it could be, yeah.
So CRPO tells us that there is registered psychotherapist qualifying and registered psychotherapist. In fact, that second category, registered psychotherapist, technically it's actually 2 categories. So when you transfer from RP qualifying, you go into RP.
Hmm.
The first RP category, it's RP supervised practice. You still need to be under supervision.
Yeah.
Yeah. So you're not independent. You still need to be under supervision, and you need to now collect another 550 direct client contact hours and another 50 clinical supervision hours.
Yeah.
And
So,
once you've done, so in total, and so once you've done that, you've collected your 550 direct client contact hours and another 50 supervision hours. You will now have in total 1,000 DCC hours
mm,
and 150 supervision hours. And now you can transfer into fully independent.
I think quite a bit of people may forget about that piece. And I
Yeah.
think it's important to reiterate that because we still don't want anyone to get in trouble and, because you still need to practice under someone. So technically, yes, you have that full license title, but the independent piece is critical part. So do you have to disclose that when you are practicing with any of the people you work with? Let's say they're coming in for your services, do you have to disclose that you're a registered psychotherapist still under supervision?
Yeah, you should disclose. So we have a consent form that we use, right? So you've got your consent form. In your consent form, you should state that you're an RP qualifying and that you're under supervision.
Mhm.
And as an RP supervised, you should also disclose that.
Okay.
It's just ensuring that there's full transparency in everything we do.
Mhm. Beautiful.
Yeah.
Okay.
But I should tell you something. Once you transfer into the first RP category, so someone as yourself, you've worked in another province, whatnot, right?
Yeah.
So very possibly you already have all the hours you need. You don't need to be accumulating new hours once because you're now registered with CRPO. You can use your old hours and use those and use them to quickly transfer categories.
Okay, let me get this straight. Okay, because I'm not sure if I got that. So it's not an accumulation of the hours. You said you can use your once you
Not an
trans.
accumulation. It's not an accumulation of hours when under CRPO. It's any hours you've done at all in
Okay.
psychotherapy. So if
Okay.
you're coming from India and you've got hours, you can use those hours from the work you've done and use
Mhm.
those to once you pass the exam, you can just submit those hours, get your supervisor to fill out paperwork for you, and use those hours. So let's say you've just applied to CRPO and you've got 1,000 hours from back home where you may have worked before. You should
Mhm.
actually just use those. You still need to be under supervision,
Yes.
but no pressure to earn hours because you've already earned hours.
Okay.
So
Beautiful.
you can just use those hours, submit them, let CRPO approve them, and then you can submit all 1,000, and
Yeah.
then you're good to go. Once you pass the exam, you can just quickly transfer and transfer.
Yes. Okay. Awesome. Now, what are some of the challenges that you've seen pertaining to this process? And just branching off of that, what advice would you provide people going through this to make it a little bit smoother if they're having those challenges?
I think the challenges I've seen is maybe a lot of confusion about the process.
Mhm.
That's maybe the main thing. Just people not being too sure about just how it works. Some people think they need to have all of these hours before they even apply, which is not the case.
Mhm.
You need to have currency hours, but you don't need to have, 1,000 hours or 150 supervision hours. So everybody's getting information from different places and people are a bit confused.
Yeah.
So
Yeah.
that's one of the biggest challenges right there. Um, One way that I would really encourage anyone who's considering applying to CRPO to go onto the website and do your own research. Just scour the website yourself. It's great to ask questions and go ahead and do that, but there's a lot of misinformation out there.
Yeah. Yeah.
Yeah. So take your time and do your own research. That's one. And what would be great is if CRPO would have like sessions such as what we're having here. I know they do it with the universities because they did it with my university. They did it with my capstone course. They do it with the universities where they come virtually on Zoom and they answer all the questions.
Mhm.
And it would be nice if they would have that for applicants as well.
Absolutely. I think that's a beautiful idea because sometimes people are not going into those recognized programs. And if you're coming in, and, like for myself, I really had to just do a lot of research on my own and it was kind of confusing. So if they held info sessions with the college itself, I think that would alleviate some of that pressure. So that's a good step to take. Now, I think the next question here, what would you consider is the biggest difference between the application process now with the revamped process from February versus, the one prior to February?
So the biggest difference you're asking?
Yeah, because I know you mentioned the mapping tool kind of changed, but what is the
Yeah.
difference there?
So I used to offer mapping tool workshops. So I used to offer mapping tool workshops where we actually met and we worked through the mapping tool. And then suddenly in January, out of nowhere, um, they shut down the application portal and they
Hmm.
said that they were revamping the application just like out of nowhere.
Yeah.
So the biggest difference would have to be the removal of the mapping tool.
Okay. So they
No, yeah,
Okay, wow. I applied for my license in what was it, August last year? So I missed out. It was a long, long, tedious process with that mapping tool.
nobody is sad about that. The
Yeah.
only people who are sad about that are the ones who actually did the mapping tool and they're like, oh.
Yeah.
So you know how much work it was.
It was a lot of work. Yes. Hmm.
So the biggest difference now is that that's been removed. And so now what they're using to review your competency is the course outlines, your course outlines.
Okay.
Yeah, so everything is the same. It's just that the mapping tool has been removed.
Okay.
Previously, you had to do the mapping tool and you had to submit your course outlines as well.
Hmm.
So mapping tool is gone, and now they just review your course outlines. The great thing about the mapping tool, however, was that you could take in the workshops. I used to have people with very random-ish masters, like a master's in research psychology with very little training and counseling.
Yeah.
And if
Yeah.
you wrote a good mapping tool, they could almost convince CRPO that they had it,
Mhm.
right?
Okay, so it can make it a little bit more challenging with those pieces for the
Yeah,
qualification.
if you don't have like a straight master's in psychotherapy or counseling psychology, but you
Hmm.
want to, let's say, I've met people, they had maybe a master's in research psychology where there was no training in psychotherapy. It's just
Hmm.
research,
Hmm.
but they want to apply to CRPO. It's going to be maybe trickier for them now.
Okay. I mean, to be honest, I think it's fair. I think that's fair, right? Because
Fair.
yeah, because you do need that like clinical skill. So if you don't really have the clinical like counseling skills, then I think, yeah, going back and getting some of the courses that you do need, it would be beneficial. So I can see
It,
like the benefits of it, and then I can see how it could be a little bit more of a struggle. But if you're just setting a certain standard for everybody, then it makes sense.
and that's what the college does. They set a standard, and I think
Yeah.
a lot of people don't realize that. But the college is there to set the standard, and that's
Yeah.
it.
Yeah. Yeah. Absolutely. Okay. Um, wow. So there's quite a bit of changes that's happening. Now tell me about if you are aware of this, but the waiting process. What
Let me tell you.
yeah.
So when I applied back in 2022, so I remember one of my classmates, she completed the recognized program because
Mhm.
she completed that. She was approved in
Oh,
3 days. She submitted her application and approved. Oh,
okay.
so back in 2022, if you were doing the recognized program, you could get approved in 3 days. I got approved in about 10 days. Yeah, in 10 days.
Wow. That's so quick.
Now,
That's so
and
quick.
that's how fast I think they used to be before COVID, as far as I understand. But COVID
Mhm.
kind of disrupted things, and it looks like things are still disrupted, even though it's like years later. Now it's taken about 8 months, maybe. Let's see. Just recently, some people reached out and said, Dela, my application just went into first review.
First.
These This was yesterday or 2 days ago. Two people reached out and said they've just gone into first review. They submitted in February of this year, and they've
Wow.
just gone into first review. There are some people who submitted in February who have been processed and they've been approved.
Wow.
So it looks like the college is still processing from, so we're currently in October. It looks
Mhm.
like they're still processing applications from non-recognized applications from February, um, March, and the website says they're processing April, but from what people are telling me, it's February. So, and
That
March.
is That's a long time because I know the biggest issue I had when I was applying and waiting, I couldn't apply for positions because every position was requesting you to have registration with the college. So I missed out on quite a bit of opportunities because of that. So I can't really imagine how someone is feeling having to wait more than 6 months just for you to get registered. So what would you give in terms of advice or suggestions for people that are in this waiting process that are looking for opportunities? What would you think would be a good, segue into this?
I would say just hang tight. Just submit your application and just sit tight. Just wait. It's a wait-in process. But in the meantime, if you're planning to go into private practice, you can start to develop that. You
Yeah.
can work on your website. You can sign up. So actually, what I tell people to do, if you are in the wait-in process and you know you want to work as a psychotherapist, you can actually start working as a counselor.
Mm.
You can register with OAM, OAMHP, the
Okay.
Ontario Association of Mental Health Practitioners. You can register with them. They take about 10 days to process your registration.
Mhm.
And you can actually set yourself up as a counselor. You can set yourself up on Psychology Today. You can start doing counseling. And then
Mhm.
once you get approved with CRPO, you can just flip it over to psychotherapist.
Oh, okay.
Yeah,
Okay.
I've suggested that to a few people, and that's what they've done. And they have done really, really well.
Okay. I didn't know that was even a pathway that you could take.
Yeah, there are so many options, right? So many back doors that you can go through to get to where you're going to. So,
Okay.
yeah.
Awesome. So would you say the Ontario Association for Mental Health Counseling, would you say this kind of similar to how CCPA works? Because I know CCPA is a little bit more broader. You're not from a licensure standard board or body, but you still get certified to practice. So would it kind of be similar to that?
Um, so they're all a little different. So we have the regulatory colleges on the one hand, the
Yeah.
regulatory colleges like CRPO, the College of Registered Psychotherapists of Ontario, the College of Psychologists, the College of Occupational Therapists. We
Yeah.
have the regulatory colleges, and then we've got professional organizations.
Yeah.
The professional organizations do not regulate psychotherapy. In Ontario, if you belong to one of the professional organizations, they do not give you the right. They do not give you the right to practice psychotherapy.
Hmm.
However, you can practice counseling.
Hmm. Hmm.
Counseling is regulated in Ontario.
Okay.
You're aware of this, right?
Yeah. Yeah.
Yeah, I know some places the two, psychotherapy and counseling, are the same, but in Ontario they're not.
Okay. And what would you say is the difference between psychotherapy and counseling in Ontario?
So in Ontario, counseling is considered to be advice given. You're just giving somebody advice. That's the definition. I think that's the legal definition. If you Google what is counseling in Ontario, it says it's advice given.
Okay.
So it's what, when you go to church, some people get pastoral counseling.
Yeah. Yeah.
You talk to a pastor, you get advice from them.
Yeah.
That's a form of counseling.
Okay.
If you go to one of the local social service agencies, you get advice from them. They counsel you.
Hmm.
They're
Hmm.
not going to do psychotherapy on you.
Okay. Okay.
Psychotherapy would be the treatment of a serious disorder of the mind or of the emotions.
Hmm.
So the
Hmm.
treatment of that with psychotherapeutic techniques.
Okay. Okay.
So you can, in fact, you can do couples counseling.
Mhm.
You can do counseling in different forms. You can do consulting, you can do coaching, and then once you're approved, you can start doing psychotherapy. So that's one route. I know a number of people, a good number of people who've done that.
Yeah.
Um, so that's one thing you can do in the meantime if you're planning to go into private practice.
Mhm.
Um, I do know some people, they're not approved yet, but they've started approaching different clinics and saying, hey, my application is there, it's being processed. And the clinics have started talking to them and they're just saying, yeah, once you get approved, just let us know.
Okay. Okay.
Yeah. Um, and I know somebody who also applied for a job and just told them that she was in the process and they hired her and they just waited for her to get the job, to get approved. So,
Okay. So some people
yeah.
are willing to wait. All right.
Yeah, it depends how far you want to go. You can reach out to jobs and say, hey, I've applied to CRPO. I should be getting approved soon. Can you consider my application, kind of thing? So,
Yeah. Okay. That works. Now, what would you say is the requirements for a supervisor for Ontario? Like what would you need to look for when you are trying to find a qualified supervisor?
yeah, that is a really good question. So, CRPO has a definition of what counts as a supervisor.
Mhm.
And just to make it clear, the person doesn't need to be registered with CRPO and they do not need to be practicing in Ontario. They
Okay.
simply need to meet CRPO's definition. So, number one, they need to meet CRPO's definition for independent practice. So, this supervisor, needs to be someone who's completed 1,000 direct client contact hours
Okay.
and 150 clinical supervision hours. If they've completed those hour requirements, that's that's good. And they need to have been in practice for at least 5 years.
Yeah.
That's the second part. And they need to have had completed 30 hours of directed learning in the provision of clinical supervision. Um, these 30 hours of directed learning could be maybe they took a course on how to provide supervision.
Yeah.
Maybe they did individual study. Maybe they did a group, like a peer group, a learning group. Um, what else? Even if they have, it's kind of tricky. So another option is that if they've actually done supervision for 30 hours.
Yeah.
So if they did it in some capacity for at least 30 hours, that would also count. So
Yeah.
those would be the requirements.
Okay. Okay. That's good to know. And especially if somebody is interested in pursuing that path in terms of providing supervision, they know exactly what to do for that. So thank you for explaining that piece.
Welcome. And I should say, I did mention, but they don't have to be in Ontario. They could be anywhere. They could be in the UK. They could be in Iran. They could be in India, as long as they meet these definitions,
Yeah.
these requirements, and they're good to go.
Okay. Beautiful. Now, looking back, what is one thing you wish you knew before starting your path to licensure in Ontario?
Um, I can't really say there's one thing I wish I knew. I have enjoyed the process.
Mhm.
Um, there has been ups and downs in the process, but in life, just everything has ups and downs. So, I just kind of roll with the punches, kind of thing. Um, one thing I wish I had known. That's really hard. I can't really specifically name anything. I wish I had known about all of the groups on Facebook sooner.
That's a great one. Yeah.
Yeah. I wish I had known about the groups because they have been one of the best places to go and ask questions.
Yeah.
I
So,
actually found, yeah, go ahead.
yeah, I was going to say, tell us a little bit more about the groups on Facebook for people that are not aware. What are some of those groups?
One of the best places to get information, but you have to be careful because within the realm of information, there's always a 10% of misinformation. But one of the best places to get information is on Facebook. There are a number of different groups for counselors and psychotherapists in Ontario, and also counselors and psychotherapists throughout Canada. There must be at least 6 to 10 of these groups. Um, so Registered Psychotherapists and Counselors of Ontario, registered, a whole bunch of them. And you
Mhm.
can go there and then just ask questions. If you're looking for a supervisor, you can just put a post saying, hey, I'm looking for a supervisor, and lots of supervisors will respond.
Yeah.
You can ask questions, hey, I'm trying to apply to CRPO. Anybody has any information? And lots of people will respond. So it's one of the best places for knowledge and information.
Yes.
Yeah.
That's how I found you too. What's the name of the group? I think it's called the Mapping Tool group or something.
Oh, right. So I do have, you may have found me in a different group. I'm not too sure.
Yeah. Probably the bigger one, the Ontario psychotherapist group, one of them. And I think I remember seeing you, and then I was like, oh, okay, I'm pretty sure that's how I found you.
I had started a group some years back, about 3 years back when I did my application. It's called Applying to CRPO. And
Yeah.
in brackets, it says mapping tool because at the time we were doing the mapping tool. So that's the group I've got on Facebook. For anybody who's looking for information on how to apply to CRPO, they can actually just join the group, post any questions, and I will happily answer.
Yeah. Yeah. Thank you for creating that, because that is such a unique and really resourceful space for people, because it is a confusing process, and to have a support group like that to alleviate some of that stress is necessary.
Oh, my pleasure. My pleasure. Yeah.
Hey. Now, there was another thing I think you're going to say about looking back and what you wish you knew. So the Facebook groups is one. Was
Facebook
there?
groups is one. Let me see what else there might be. Um, not, I was about to say not being afraid to ask questions, but that's what the groups are for.
Mhm.
Um, I can't really think of anything else, to be honest. Yeah.
Okay. Okay. The other question I have, if you could change one thing about the Ontario licensure process, what would that be?
Currently, I wouldn't change anything because they've already made the most important change by removing the mapping tool.
So you're like, that was it.
That was it. And so currently it's pretty straightforward. All they're asking for is your name, your details, your name, date of birth, address, telephone number, your course
Mhm.
outlines, the one thing some people may find challenging is the currency requirements.
Okay.
So when you apply to CRPO, CRPO wants to know what recent experience you've got in the field,
Yeah.
right? They want you to be a therapist who has up-to-date knowledge.
Okay.
Um, if you graduated 20 years ago, can you apply to CRPO? Yes, you can, but they want to know that you've got current experience and not outdated experience for the safety of the client, right?
Mm.
So the currency requirements is one thing that some people are finding challenging. Not everybody, but for people who haven't worked in the last 5 years or the last 3 years, they're finding it challenging. But
Mhm.
CRPO has actually done something about that. If you have not worked in the field, and currency hours could be anything. It could even be volunteer work.
Yeah.
It could even be just you've done a few courses or you've gone back to school. Um, but for someone, if anybody does not have any currency hours in the last 3 years, CRPO now has a section where they say to you, okay, if you don't have any currency hours, how do you
Mhm.
plan to gain those hours?
Okay.
So you simply need to have a plan and tell them how you plan to do it.
Okay. And then they'll be able to accept that.
Yeah, exactly. Yeah.
Hmm. Awesome. And I have a couple more questions. How do you see the mental health field evolving in Ontario in the next few years?
Okay, so definitely there's a need for mental health practitioners in Ontario.
Mhm.
And when you think about it, there's so many different categories of mental health practitioners, not just psychotherapists and counselors. I mean, there are child and youth workers.
Yeah.
There are family therapists. There's so many, and there's such a need for it. There's such a need.
Mhm.
There's mental health and addictions. Um, I know if you go into the groups on Facebook, there's a lot of chatter about, a lot of talk about, there are too many therapists now.
Saturated. Yeah, yeah,
See
yeah,
those people put in those posts. Um, I feel as if there's a group of people who feel that there shouldn't be too many therapists because it's, I don't know, maybe they feel that it's taken business away from them. And then there are people like myself who it's not something that worries me.
yeah, yeah.
I think there is a mental health crisis. So whether or not it's in addictions, whether or not it's in youth, child and youth, but there is a mental health crisis, and we need really good practitioners. And that's what I try to do. I try to offer the best services I can, and the population out there needs it. So we need that. So I think it's going to be a continuously growing field.
Yeah, yeah.
I do think there's opportunity to diversify because
Mhm.
there are a number of, so we know well about the mental health crisis, the addictions crisis
Yeah.
in cities such as where I live. I live in London, Ontario. There's big mental health addiction crisis, right? But there are lots of other areas that a person can expand into. There are people coming to me with personality disorders, such as paranoid personality disorder, with just um, different symptoms that a lot of therapists may find challenging to work with, and those are great areas to expand into.
I definitely agree with that too. Just the more severe mental health diagnosis is those are areas that people need a lot of support in. So I think you're absolutely
I was going to say the curious thing is that I think some of these more complex cases and severe disorders, they may have been disorders which were for a long time being treated by clinical psychologists.
right. Hmm.
And this is what happened. So when I did my internship, I did my internship at a nonprofit.
Yeah.
And we had a lot of clients who didn't have insurance. They couldn't afford a clinical psychologist.
Mhm.
They couldn't get on the wait list for a psychiatrist, so they were coming to us like interns. So that actually gave a lot of training in those disorders.
Mhm.
And so I have the realization that these more complex cases, they're actually coming to psychotherapists for treatment
Yeah. Yeah.
for different reasons. They can't afford psychologists, whatnot. So those are areas to expand into. Yeah.
Absolutely. And I will even touch upon the saturated piece. One of my professors, I will never forget what she told me. Well, she told our class when she was talking about it. And she was mentioning we don't ever really complain about there being too many burger joints and pizza joints, right? There's a ton. You can go down the street and you'll see a ton of pizza places. They all sell pizza, but they're still thriving and still doing their business. And whoever wants to go to that pizza place will make it there. Think about therapy the same way, right? There's going to be a wide range of people, but there's always going to be people coming to you and seeing you. So not to worry about those things because there's always going to be more pizza and burger places and dessert places. And the same thing can be in our field.
Yeah, I was recently talking to a doctor. He may have been a neurologist, and he was asking me. I mean, I wish I could find the articles he sent me, but he was asking me whether or not I can't remember. Oh, there it is. Functional neurological disorders,
Mhm.
and asking me whether or not I've got. I just went for a doctor's appointment, and he's like, "Hey, do you have experience in this area?" I'm like, "Unfortunately, I don't." But he said it's an area it's an emergent area right now, and there's lots of opportunity in it.
Yeah.
So again, so many areas to expand into.
People can expand, and that's the beautiful thing about this field, right? There's a lot of areas that you could just tap yourself into, and you can always change around if you want to explore another place. And yeah, it's never there's not a dead end to it. Yeah. Now, the last question I have What legacy or impact do you hope to leave in Ontario's mental health community?
That is a really tough question. Um, so the work I do, it truly is an extension of myself.
Mm,
It's my vocation. But what legacy do I want to leave? And I know I read, okay, what legacy do I want to leave? It's so hard to say. Um, so the work we do with our clients, it's a relationship. It's a
mm,
professional relationship. But for the client, it's something so personal. They're coming to you and they're just sharing their lives with you. So the legacy I really want to leave is that I just want to make a great, uh, I just want to, how can I say it? I just want to be sure that I'm giving my all to my client so that they're getting the resources, the tools that they need, the information they need to actually, the listening ear that they need to actually make solid changes in their lives. I want to be sure that I don't think therapy has to be forever. If you're doing it forever, something isn't working. Um, so sometimes you need it for a few years, but I want to be sure you're coming and there's actual change being made so you can go on and be a healthy, thriving member of society.
mm.
So I think that's the legacy I want to leave. Uh, Clients and people in relationship with others in society and in relationship with community and who are thriving and succeeding in life. Yeah. So they can say, yeah, I went to Dela and, I was in a really going through a rough patch. I didn't know where life was going to go. But she walked with me and wow, now I can give back.
Yeah,
Yeah.
beautiful. All right. So I'm going to just pause it there. Thank you so much for providing us such amazing information.
Wait, sorry, you forgot to ask me what area I specialize in, most of my clients.
You know what? Drop that there. Drop that there. What is the area?
So it's actually interesting because when I did my master's, so I did it in a master's of pastoral in
Mhm.
psychotherapy, but I was not really focused on the pastoral part. So I'm actually trained, I can work as a chaplain
Okay, awesome.
or even as a pastor and as a psychotherapist.
Okay.
But I was actually just more focused on the psychotherapist route.
Mhm.
Most of the clients who come to me come for Christian counseling. They want to have their faith incorporated into their treatment. So
Yeah.
that's what most people come for. I do have clients come in for all other things, like everything you can possibly imagine. They're going to come for, but most people are like, no, I want to have my faith worked into my treatment. And I have clients who are not just Christian. I might have clients who are also Muslim, Hindu, but they want to have
That lens kind of,
spiritual care.
absolutely.
They want to have spiritual care. So that's a big thing that people are searching for right now. Yeah. Yeah.
Beautiful. Well, thank you so much for sharing that. I think that's vital information. I'm going to put your contact information on the description for YouTube, and that way people can reach out to you if they are interested, and they can follow the Facebook group. So I'll put some of those there as well. But yeah, I just want to thank you so much for giving us your time and sharing your knowledge and your wisdom. And yeah, you're already making such an impact and legacy as it is by supporting all these new counselors and even seasoned counselors to continue in their path of licensure. So thank you. Thank you so much.
And thank you so much for the work you do with your channel. Thank you. Yeah.
Mm. Well, everybody, thank you for tuning in. The next episode, we're going to be doing one for Florida. I know that one has been an ask. So tune in for that one. I haven't set the date yet, but there will be a date. All right. Take care.